Okay, good morning. We are going live now because we had a couple schedule changes going on in our life with the kids and everything going on like that. So what I'm going to do is share my screen with you. Don't you always love it, right? And then we're going to go to slideshow from beginning. So welcome. I am so glad that you're here to talk about detoxing because it's such an important topic that we address. So many people are divided on this topic, understandably, but I want to give you the background and why we're here because there's no doubt anymore that our bodies are toxic. Toxins accumulate and build up in our tissues, and since we're exposed to toxins every day, our bodies have to work really hard to clear them. It's important to strengthen our ability to detoxify and lower our toxic load. So, I'm going to invite you to join me here learning about a comprehensive detoxification program that will make a significant difference in your life. It's practical and scientifically designed to combine some of the best detoxification methods and lifestyle practices proven to produce the best results. Just as usual, our disclaimers and notices that we're not here to say anything is curing, treating, or doing anything like that. This is a program that is copyrighted by Linda Clark, who's an amazing person, and using Apex's Detox 360 system. But we can integrate many different programs, and that's what we're going to talk about here today. And at the end, I have a couple special bonuses for you that include a free mini consultation with me, picking out a detox kit that works for your body and the right program for you, because everyone's a little bit different. So in just 4 weeks, that's all I'm asking for. You will experience what it feels like to detox your body, detox your diet, and detox your life. You'll experience not only what it feels like to have more energy, but also what it feels like to have a greater sense of well-being. Chances are that everyone around you will also notice the difference in you. Now, we all know that we live in a world of toxins. Never before in human history have we been exposed to such high levels of toxins from the air we breathe, the chemicals in our foods, the release of chemicals in our homes and workplaces, all add to our toxic load, which we can see with the chemical fires going on, train derailments, everything that we don't even hear about. We don't even know about things that are being leached into our water, especially living in Missouri and the rivers and old nuclear issues that are here. We have a lot that we need to actually be concerned about. So what are toxins? A toxin is any substance that can create irritating or even harmful effects on the body. Many toxic substances, such as the chemicals we use to clean our houses, have been shown to collect in our body. Many have been shown to weaken our immune system, deplete our nutrients, and cause disease. And I don't want to be the fear-mongering person here, like, oh my gosh, you can never do this again, you can never drink coffee again, you can never clean again. Like, there's options around this. But the main point that I want you to understand is that we're never not going to be bombarded by things in the air, in our water, in our food, in our every single daily life. Every time I pick up my mouse, I'm touching plastic. I'm getting toxins in my body just from these things. So they're all around us. Right now, this was written a while ago, there are 80,000 chemicals used in the United States. It's estimated that there are 2,000 new chemicals generated each year, most without Environmental Protection Agency's regulation. Most of the toxins found in our environment did not exist 30 years ago. And this is one of my favorite things to talk about when I do classes, because I talk about the invention of diabetogens and obesogens, and many of you are familiar with xenohormones. So obesogens are obese, so obesity, and gen meaning genesis or the creation of. So chemicals that cause obesity, chemicals that cause diabetes, chemicals that cause autoimmunity. So when someone comes to me and they say, oh, I have this autoimmune illness, it must be genetic. it's probably, everybody's telling me it's trauma and I need to go see a therapist. I'm like, well, what about all the toxins that are in your body accumulating in these tissues that are sick? So there might be a lot more going on than just a simple genetic issue. Our toxic burden is really growing because of our exposure to all of these things. Like we talk about what we put on our skin, the things we find in our food and our water supply all add to our toxic burden. From the time we wake up in the morning until we go to bed for the night, we can be exposed to as many 200 or more chemicals. I think there's a lot more. And when I started teaching doTERRA classes and would talk about clean cleaning and clean skincare and clean makeup and things like that, every single class, some of them would say, well, I read, or I'm going to give you a classic, and this is not judgmental, but like my husband's a chemical engineer, and he says the amounts of these things are so small they would never affect us. And I would always say, great. And then I'd start putting my hands up. So let's go through an average day. What does your day look like? You wake up. Do you take, let's say you take a shower. So you're exposed to the water and nastiness in there, covering your whole body. You shampoo, conditioner, soap, face wash. Let's call those the basics. And you get out of the shower, use lotion. How many face creams do you use? What do you put in your hair for heat protectant, styling gels, mousses? There are so many products, right? What about makeup? Now we're up to 10 things. Did you brush your teeth today? Now we're exposed to even more. And that's just within taking a shower and brushing your teeth and getting ready for the day, let alone everything that comes from our food. You wake up, you have coffee. Now we have concerns about mold and pesticides. We're eating this. We're breathing in air. We're having all kinds of issues. Heavy metals is something that a lot of people are concerned about. The EPA says there are at least 4 million pounds of mercury in our environment every year, and it's generated naturally in the environment from volcanic emissions. But there's also a really big issue with people who drink well water. I see that in hair analysis a lot as well. Amalgams from our teeth containing mercury, as well as other heavy metals. Damaged or trans fats found in fried foods, vegetable oils, and because they're not natural fats, they create free radicals and cause toxicity and damage to our cells. I was joking with my husband about do you remember Olestra? He didn't remember Olestra, but it was a chemical that they put in all of the fried foods because it was a healthier in quotation marks fat than having trans fats, or I think it technically was a trans fat, but it gave everybody horrible GI issues. And it's just something we accepted as normal at that time because it was better to be skinny and what we thought was healthier by these chemicals than eat real food. And we know that cigarette smoke is a major issue, and that smoking yourself, secondhand smoke, and then even thirdhand smoke, from being around people who are around smokers, can cause a lot of damage to our lungs, and we can still absorb a lot of those chemicals. We know that environmental chemicals such as pesticides and herbicides are an issue. Environmental pollutants from gasoline emissions, and our constant exposure to things that are leaching into the ground. Food additives, which is another major issue. And many of them are byproducts of petroleum production. And that's the biggest problem with our supplements as well, is that they're made from petroleum products as well. So what else contributes to our toxic burden? Every day we make our own internal toxins that create a load of inflammation. In the process of making energy, our body creates metabolic waste products, which can lead to further inflammation. When the liver breaks down hormones, waste products are also created. Even when we exercise, we create inflammation. So it's important that we have a healthy liver and a healthy detox system so we can clear that inflammation. And really, if you're like, well, what does that even mean? So if we think about exercise, we're breaking down muscle and we're creating micro tears in them so they can actually heal and grow stronger, which can create lactic acid. And that has to be cleared out of our body through our liver, through our gallbladder, and through our gut. our cells are constantly making garbage. That's why our gut is kind of a garbage dump, right? The liver and the kidneys clean that out, but we still have to be able to get rid of it and clear that. So everything that we do is making waste, in some ways, good ways, like exercise, and just making cellular energy in general. Our lymphatics are constantly clearing out our organs, and our cerebral spinal fluid is clearing out our brain and picking up particles and inflammation from our brain and our immune system. So we do have to contribute to taking care of ourselves, even if you live the most perfect life, right? So how does toxicity occur? Now that we know that toxins we are exposed to are on a daily basis, one large exposure can create a body burden of toxicity. However, for most of us, it's the small, repeated, small exposures each day that accumulate in our tissues. So maybe you go swimming, one large exposure might be you're close to the plant that caught on, the chemical plant that caught on fire, and you were told to shelter it in place, and you're breathing in all of those chemicals. Or I think of issues like with nuclear power plants. That's like a one large exposure. But for the majority of us, it's just that living day-to-day life. Like, again, those, just from waking up, taking a shower, brushing your teeth, and putting makeup on, you've already had a couple thousand chemicals put on your body that your liver needs to address, that absorb directly into your skin. And in order for us to keep from building up this toxic burden, right? Because the toxicity stores in our fat, in our liver, in our bones, and in our other organs as well. Our body has to effectively break them down and eliminate them. Our body does naturally detoxify itself. That is true. Our liver and our kidneys and our gut do a lot of work, let alone our skin, our lungs, everything contributes to this. But if our vitality or our metabolism is slow, our detoxification mechanisms can get sluggish. If we have been eating a diet that is low in vitamins and minerals, or we have problems absorbing correctly because we have IBS or thyroid problems. There's a lot of things that can be an issue there. We don't have the nutrients needed to run the detoxification pathways. And really, this is where things like MTHFR come into play, because if you can't use your methylated groups correctly, those B vitamins and those methyl groups that we get from them are so important for hormone health, for sleep, for our liver and our gut to clear these things out. All of the combined inner and outer toxins cause a wake of inflammation and create a total load effect on our bodies. So the reality is that the EPA has not demanded that chemicals and toxins are tested for safety. As you can see, the EPA has only banned 5 chemicals in the past 30 years or so, even though many more have been shown to have serious health consequences. This has unfortunately left us wide open for exposure to chemicals that may cause us harm, even in small doses. And this is, again, like I said, obesogens, diabetogens, xenohormones. Those are just the things we know. Everything that's wrapped in plastic has not been tested. Well, it has been tested. It's just proven that it's unhealthy, but no one's banning us from being exposed to these things. And when I taught a gut health class a couple months ago, people say, well, all disease starts in the gut. And I say, well, actually, I think all disease starts with the EPA not taking care of us. The people who are supposed to protect the environment are really protecting the companies that are creating these things, because there's so much money to be made that who cares that the downstream effect is people who are just chronically ill and very, very sick. The CDC runs research studies every year that measure the levels of exposure to some commonly used chemicals. And one study, 2009 seems like yesterday, but that was a while ago, and 2,500 volunteers that included both adults and children, chemicals were tested in blood and urine. And what they found was multiple chemicals were found in the blood, and the urine of the study participants. Some of the chemicals found were BPA contained in plastic bottles, PFOA from nonstick coatings on cookware, and fire retardants. And we're exposed to fire retardants in most of our furniture, the upholstery in our car, and in our clothing. Some states have made it mandatory that every child's piece of clothing is coated in fire retardant chemicals, which sounds wonderful. Like, we're looking out for the safety of the children, but all of that gets absorbed through the skin, especially when you're sleeping in it, you're playing in it. I don't know about you, but my kids are in their PJs all day long, right? Especially when they were little. The other thing is that you might be going, well, we don't have BPA anymore. I drink from BPA-free bottles and things like that. Well, what happens is either they change the name of it, they change the name of the chemical, or they make a different chemical that usually tends to be 10 times worse. I think the new one right now is BPD. So when you go to Target or Walgreens, Walmart, and you're like, I need a new water bottle for myself this year, and you pick something up and it says BPA free, you're like, sweet, got it. This is going to be just fine. It's healthy. What you don't know is that it's coated in worse chemicals than BPA. Same with nonstick coatings and cookware. Like, every time we think we found the right one, it's actually that they just made a new chemical that's even more dangerous, and things just keep getting worse and worse. So the CDC's position on chemical exposure says the presence of environmental chemical in people's blood or urine does not mean that it will cause effects or disease. The toxicity of a chemical is related to its dose or concentration, in addition to a person's individual susceptibility. Small amounts may be of no consequence, where larger amounts may cause adverse health effects. Where the reality is that even small amounts of some chemicals can cause adverse health effects. It is not even the amount of exposure, but the type of chemical and the individual's person's health and susceptibility. There's a very famous study undertaken by the EWG, the Environmental Working Group, which is a nonprofit formed to fund studies on the effects of chemicals. In this study, the cord blood of newborns was tested to determine the amount of toxins in the cord blood. The research found over 267 different chemicals. The umbilical cord provides nourishment to the growing fetus from the placenta. Toxins can cross from the mother through the placenta into the umbilical cord and then into the baby. The study shows that babies start out in life with a toxic burden. And look at all these things that are being found. Same with breast milk. I remember when this program, I started teaching this right before my son was born in 2012. And I remember, reading about breast milk and how rocket fuel is being found in breast milk. And you'd think that I'm not drinking rocket fuel, but we're so exposed to it that we're passing this on to our children, and our children are already born inflamed and sick. Breast cancer beginning in utero, it shows that chemicals we use and are exposed to every day act like hormones and hormone disruptors. There is an analysis of breast cancer studies by a team of research scientists from Harvard University. They concluded that exposure to hormone-changing chemicals begins in the womb, and that these chemicals can program fetal breast cells to make genetic changes that could eventually bring about breast cancer. In the light of the study on the cord of newborns, and just like I said, breast milk, it is now obvious that the fetus is exposed to a host of chemicals that could lead to future health consequences. It is so important for anyone who wishes to have children to undergo a detoxification program several times before getting pregnant. And that's something I did as well, to detox myself as much as possible, not only to support my own fertility. I had my husband do a couple detoxes with me as well to support his fertility, but also for the safety and healthiness of our baby. And here's another study that really surprised the volunteers who were environmentalists. At least 48 different chemicals were found in the blood of each of these 5 dedicated female environmentalists. They included fire retardants, mercury, perfumes, and rocket fuel, which is the polytetrafluoroethylene. We may do our best to lead a very toxin-free, plastic-free, very clean life, but we're still going to be exposed to these things. And what we don't understand is that the studies that are done on our drinking water are really interesting, because most people, and no judgment, because medicine saved my life, and I do believe in using the best of all of the world, that women who are on birth control, people who are on antidepressants, people who are undergoing cancer treatment, all of those chemicals from these pharmaceuticals, we urinate them out and we defecate them out. They get into our water system, and because they're so minute, they're so small, we can't filter them. We can't filter them out of our public water system. So literally, we're drinking birth control every single day. We're all drinking antidepressants every day. And I'm not going to sit here and say, don't take birth control or don't take your antidepressants or no one should do chemo. Absolutely not. Take your medication. It can be life-saving and it's important. But at the same time, you have to realize that if you're not taking these medications, that you're still being exposed to them. And that might be affecting your fertility, your hormones, all of these things. And you might be doing everything right. The same thing that happened to me. I did everything right to stop the growth of my uterine fibroids. And in the end, they just kept getting larger and larger. And I truly believe, one, not is it only the medication that I was on, because it's not being studied in women, but two, because of this high toxicity burden that my body could no longer bear and get rid of all of these things. Man, this sounds like a conspiracy theory, but we love to talk about sunscreen when we talk about toxicity, because everything that's in sunscreen has been linked to allergies, hormone disruption, and cell damage, and it helps other chemicals penetrate the skin. Oxybenzone, which is a penetration enhancer. So we talk about, does the incidence of our increase in skin cancer, is it related to being in the sun, or is it related to putting all of these chemicals on our skin that should not be there, that are causing allergies, hormone disruption, and cell damage, and then wondering why we're getting sick, when we know that the sun is very healthy for us and really vital to our health. The EWG has shown that 84% of the 910 sunscreen products tested contain oxybenzone. So visit ewg.org. They have great information about all of this, and you can find safe ones. That's why we only use doTERRA, because we know that it's safe, it's reef safe, all of those things as well. Oh, my apologies. The slide is on top of each other, but anyways, DEET, I feel like DEET is really old now, but it's still something that we have to talk about, because a lot of people still use OFF and all of these other major brands because it's so effective, right? We want to go camping. We want to sit outside. I can't go outside for more than 30 seconds without getting like 30 bug bites. And I'm like, I want to be outside. I want to be in the sun, but I don't want to be dealing with this. So we have to know that these insect repellents are also neurotoxic. And when we start to look at all of this information, it starts to feel really overwhelming. And we're going to go through this here in a little bit. But the goal isn't that you burn your house down and you move and you live in some type of tent in the country and you cook from scratch and you never touch anything. That's not the goal. The goal is that we slowly and simply switch out some of the products. Like, what are the most toxic products that you use in your home right now, or in your daily life? And then how can we switch those out? So do you want to start with a water filter? So when we talk about water, stainless steel or glass only, that's really important. I apologize as my voice is starting to go. Maybe you clean for a living or you clean your home often. Can we switch out to natural products, whether you make your own or you check the EWG website to see what's clean and not clean, because a lot of the greenwashing is what it's called, is like the companies make it appear like it's clean and not chemical laden, however it is. Can we switch to essential oils as a insect repellent? They're like these little changes, and then before you know it, we've switched over to things that are non-toxic, and we've reduced that load as we continue to work on your health. So, symptoms of toxicity. How do we know? And when I look at this list, I go, yeah, look at the bottom. These symptoms may be related to other factors as well. And this is why functional medicine is so amazing, because we can get to the bottom of this. We can do basic lab work. And this is when someone who comes to my office and says, Alison, I feel like crap. Nothing feels good. I don't know what to do, but my blood work's normal. My endoscopy, my colonoscopy is normal. Everything's normal. My chest x-rays are normal. My heart's normal, but I still have palpitations. I still have IBS. I still have all these allergies, and they just keep getting worse and worse and worse. That might be a sign that these things are toxicity related. If you find that you are becoming more and more sensitive to things, that might be a toxicity related issue. And then we can talk about how these toxins break down the barriers that are supposed to protect us. Like leaky gut is the most common that we talk about. And if we don't seal up that leaky gut, we're going to continue to have these toxicities because it's going to keep circulating in our body. But we can have leaky lung, we can have leaky brain, we can have leaky heart. So we really need to address first, is there something very serious and major going on, right? Like, do you have thyroid? Do you have Graves? Because what if your anxiety, depression, mood changes, insomnia, nervous, like what if that's coming from somewhere else? And at the same time, we can start to detox your body. Problems related to toxicity, absolutely. All of these things are related to a build-up of something that the body cannot release. And it might be chemical. It might be something that we're eating, like maybe you're bringing in too many parasites, bacteria, and yeast, worms, and fungus. It could be cortisol buildup and autoimmune issues. There's lots of things here that are related to toxicity that need to be addressed. So since most toxins are fat soluble, meaning they can go into fat easily and stay there, they're stored in fatty tissue. This means the abdomen, the visceral fat around our organs that protects us, the brain, the liver, the lymph system, and the extracellular fluid that surrounds every cell in the body. So what does it mean to detox? Our bodies have built-in mechanisms for detoxification. This process includes dislodging the toxins from their binding sites in the body, supporting the organs of detoxification to break down the toxins, and clearing and filtering the waste products left over from the detoxification process. So we want to work with the organs that we have and help them clean and filter more effectively as well. The reality is that we can't avoid the toxins getting into our system because we're exposed to hundreds every single day, maybe even thousands, depending on where you live and your lifestyle and your job. Our mechanisms can get overwhelmed as the toxins accumulate and get stored in our tissues. It is this accumulation of toxins that causes low vitality and troublesome symptoms. At the same time, our detox mechanisms get very sluggish. This is why it is so important for us to undertake a specialized detoxification program to strengthen our ability to clear these toxins. By doing so, we can take the stress off our energy system, which uses up quite a bit of our energy clearing the toxins. One of the comments from those who have undergone these programs is how much more energy they have at the end of the program. Because think about it, we're clearing out the brain, we're clearing out the liver, we're clearing out the lymphatic system. Our body doesn't have to spend all of its energy cleaning. It has the ability to heal itself. So 80% of detoxification is done by the liver. The liver breaks down toxins into water-soluble substances, and then these substances are attached to nutrients or amino acids so they can be eliminated primarily through the bowels. Toxins are also eliminated through urine, perspiration, and through the skin. So essentially what I like to say is the liver takes it, all these things, whether it's our own toxins, our own waste from our cells, waste that our immune system creates, or our lymphatic system reduces out, and what we're exposed to, and it puts them in a package. And that package is called conjugation, and that goes into the bile. The bile goes into the gallbladder, and when we eat fat and food, the gallbladder releases the bile into the small intestines to, one, help break down food. So bile is an important part of our digestion, but it also helps us flush out everything as well. So drinking water every day and hydrating the body is crucial for supporting detoxification. Eating healthy foods, we all know these things, right? Just a good general reminder. So who needs detoxification? Anyone who's wanting to feel good and achieve an optimum level of energy and health. So this Detox 360 is something that we can use to help your body detox not only just your liver, but every system down the line. So we're going to talk about the body. We're going to talk about, are we going to use homeopathics, herbal, nutritional, essential oils for targeted organs. We're going to talk about how to detox your diet. And so that way it's going to be personalized for you. And then, like we talked about before, detoxing your life and all of those practices as well. The detoxification experience and process, we want to alkalize and nourish the body with wholesome, fresh foods. And for everybody, that can look a little bit different. Supplementation, because we want to help support the elimination of toxins in all of these really important organs. Homeopathic cleansing can help stimulate the elimination organs as well. And it can also help reduce the viral and bacterial load on the body. We want to avoid certain toxins. Of course, we want to engage in physical movement. Now, when it says exercise, that means something different to everybody, right? For some people, that might mean just getting up and walking around the office. Just, can you take a 10-minute break, get up, go to the bathroom, do a lap, and come back? For other people, that might mean getting up and going to the gym. For other people, that might mean doing yoga at home with the kids, right? So it's very personalized. We want you to sweat, so that way it's also going to be detoxing, but also supportive for the nervous system, and a lot of self-care. So what we're going to do is, I'm offering a free 4 to 6 week program. It's designed for 4 weeks, but we're going to include 2 weeks on there to help you reset, renew, and revitalize your body through functional medicine, nutrition, and essential oils. There's going to be weekly online support meetings. You're going to get a custom detox supplement kit. So I want to meet with you. I want to know what's going on with you. I want to pick the right program for you. And honestly, budget and included in mind, because we want to make sure that we're doing the right things for you as well. Throughout the program, you'll get one-on-one attention. We're going to personalize your detox plan, and we're going to do this together as a group, because it is really, really easy to do. We're going to give you a step-by-step detox plan, as well as that community support. So we're going to do targeted things. Like I said, this is from the Detox 360 program on the targeted nutrition and the drainage formulas. We're going to give you dietary guidelines, maybe some different recipes, how to choose food, how to manage your program, and really be good. So in case you have to include your family in this as well. And in this program, we're going to go through a little bit deeper dive into detoxing, into water, sleep, exercise, all of these things that can be really important for you. So the targeted nutritional support might look like a doTERRA kit. And that would be their multivitamins, their omegas, their probiotics, their digestive enzymes. I would add in GX Assist to help with leaky gut and break down any biofilm and problems like that. And then MetaPower to help support healthy levels of blood sugar. And then the oils will also help be kind of like that homeopathic side to help support the drainage of those those organs. Optional, and we'll discuss this during your consultation, we can add in the liver, the kidney, and lymphatic drainage just to help support those organs as well. So when we eat, we want to eat organic foods. That's the ideal. We want to clean with green chemicals, cleaning, drink filtered water, and use organic chemicals in your garden if you can. And I know that there's a picture of some fruits and veggies here. And maybe for you, detoxing looks like keto. Maybe for you, it looks like Whole30. Maybe for you, it looks like carnivore. There can be a lot of different things that we can really choose to incorporate into our body. So how does exercise support detoxification? Exercise is really key to this. So it raises our core temperature to cause sweating. It improves the body's ability to handle stress. It improves immune function. It improves circulation. It improves sleep and improves production of internal antioxidants. And of course, it's great for serotonin and dopamine and our mood and our brain health as well. Now, this is why I like to work with people individually, because you might be sitting here, and I'm an autoimmune patient myself. So when I started to get sick, I would work out and I'd be really great. I'd hit it for like 2 weeks and be like, man, I'm doing so good. My energy's back. My life is back. I'm increasing my weights. I love to lift weights. And then I totally fall apart. And I'd be like, oh my God, my ulcerative colitis, which is like Crohn's, I'd be in bed in pain or just in the bathroom. It ruined my life. And then I'd have to take a month off. And then I'd be like, oh, you're just so lazy, Alison. What I didn't realize is that these high intensity workouts I was doing was increasing my immune function. But when you're an autoimmune patient and you overtrain, your immune system's like, I got you. Let's go kill the rest of that organ. So of course I was giving myself a flare. So everyone's individualized. If I said everyone needs to do ice baths, high intensity workout, train at 4 o'clock in the morning, go to bed by 7 p.m. and eat 2 meals a day, that would make probably 80% of my clients sick. It would make me sick. And also, who's going to put my kids to bed? Like, it's just not possible for everybody. And men and women are so different. So for a man, that might work out wonderfully and fit his schedule and fit his physical needs. Men can tolerate cold baths more easily. Studies done on women show that it actually lowers active thyroid hormones. Women don't need lower active thyroid hormones due to ice baths. So we still have to be very careful in how we address these types of programs. If you hear anybody say, everyone should, that is your clue that that person probably has no idea what they're talking about other than the very basics. Everyone should drink water. Everyone should eat as healthy as they can. Those are okay things to say. Everyone should do cold baths. There's a warning bell that should go off. Everyone should be vegan. Everyone should do carnivore. Everyone should eat this. No, not true. It's not true. Okay. So consistent elimination. We're talking about pooping. Yes. Increasing fiber by increasing fresh vegetables and fruit. For some people, if you might have SIBO, small intestinal bacterial overgrowth, and increasing that fiber increases gas, bloating, IBS, acid reflux. It makes you miserable. So we have to get rid of that infection before we can start doing that. Make sure that you are consuming adequate amounts of filtered water. Sure, that's a great one for everybody, right? Exercise is wonderful to assist with regularity. Because that movement helps the GI system move as well. Walking after a meal is the best exercise that you can do. So that doesn't mean you have to be like this guy and get on the treadmill for 3 hours a day. It means go take a 10-minute walk around the neighborhood after dinner. That's the best thing you can do. And if you can tolerate fiber, I love doTERRA's fiber. Just add it to a protein shake or just add it to water, get it in, and you'll see a really big difference with that. And the reason that we talk about fiber so much is because it helps grab onto things that are being released by our liver and our lymphatic system in our digestive tract and help carry it out. So it's not just about good stools, good elimination. It's also about what that fiber is doing. So what else can you do? Closet cleaning, getting rid of the things that decluttering essentially is what that means. Self-care is what I always say, whatever that means to you. If it means taking a bath at night, going to bed at the same time, maybe it's going for that run, taking care of you. Skin brushing and lymphatic drainage is really, really important. You can do that before you shower to slough off any dead skin, increase circulation, taking time outs. I always tell my patients to treat yourself like a toddler. Give yourself breaks. Take a nap. Get ready for bed. What do we do for our babies when we get them ready for bed? We give them a bath. We put them in comfy PJs. We snuggle up and we read a really good book, or we talk, or we tell stories, and then we have a nice calm down, slow evening. But for adults, we never let ourselves do that. Listening to soothing music, maybe that can be part of your nighttime routine or your morning routine. Maybe a massage, craniosacral therapy, chiropractic, Reiki. There's so many things that we can do there. And relaxing is also really important as well. So the cleansing strategy is going to be including probably some kind of shake to help, one, increase nutrition. A lot of times, one of my previous functional doctors called it pre-digested. So, making smoothies, drinking protein shakes, things are easily assimilated and absorbed in our body. Eating wholesome detox promoting foods. For some people, that might mean more greens and fruits. For some people, that might mean carnivore or keto, just depends. Supporting elimination organs. So whether we do that with homeopathy, nutrition, or essential oils, we're going to move, we're going to sweat, we're going to rest and relax. So again, I invite you to the Detox Blueprint, A Path to Wellness. That information is all in the bottom here. You can message me at littleblackbagmedicine.com. We're going to start next week, so make sure to join the group and schedule a free consultation, and we'll be able to walk you through what you need specifically, and then do this together as a group so we can really focus on educating you. And I have even more where did we go? There we go. I have even more papers that programs and things that I want to share with you. Clinical pearls about menopause and hormones and female hormone imbalances. And what about coffee? What about xenoestrogens? What about food additives? How do we heal? I shouldn't say heal, but address our liver and hepatic biotransformation. What do you do if where did it go? It doesn't matter. What do you do if you're someone who is really sensitive and you're like me and you're like, I can't handle medications. I can't handle taking a lot of supplements at one time. We go through those things very slowly and work together, and it might take longer than 6 weeks, and that's okay. We'll be here for you. Do we need to do testing for you? We can get all of that taken care of together. So I'm showing you, we got lots to go through. So I really appreciate you being here, taking the time to learn, taking the time to go, hey, you know what? Maybe toxicity is part of the issue of what's holding my health back, and how do I address that? So thanks for tuning in, and we'll see you in a few weeks when we start our Blueprint to Wellness.